Acute Care Nurse Assistant, Module 6, Nutritional Care. Content 1, Basic Terminology, Terminology and Clinical Setting Application. Content 2, The Importance of Balanced Nutrition. Discuss how the body utilizes food for growth and repair to maintain health. Discuss signs of good nutrition, including shiny hair, clear skin and eyes, well-developed body, uninterrupted sleep patterns, appropriate appetite, regular bowel habits, and pleasant disposition. Content 3. Alternate methods of delivering nutrition. The purpose of alternative nutrition is to supply nutrients when food cannot be taken orally. Types: IV infusion, IV injection, hyperalimentation, total parenteral nutrition, TPN, gavage enteral, such as a nasogastric tube, NGT, or a gastronomy tube, or PEG tube. Safety: observe IV sites for leakage, redness, and swelling. Assure the head of the bed is elevated greater than 30 degrees if receiving NG or PEG tube feedings. Observe for change in stools if receiving enteral feedings. Content 4. The 6 food groups of the food guide pyramid, and give examples of each. Grains, vegetables, fruit, milk, meat and beans, and oils. Content 5. The liquids or foods allowed on the 5 basic facility diets. Regular, house, or select diet includes a normal diet based on the 6 food groups, including very rich foods and highly seasoned foods. Full liquid includes 6 to 8 ounces of liquid every 2 to 3 hours. All liquids, strained cereals, soups, sherbets, gelatin, eggnog, milk, ice cream, and plain ice cream. Clear liquid. Feedings every 2 to 3 hours. Allowed: tea, coffee with sugar, no cream, strained fruit or vegetable juice, gelatin, fat-free meat broth, ginger ale, 7-Up, apple or grape juice. Provides inadequate nutrition to meet nutritional needs. Soft diet. Low residue, mildly flavored, slightly seasoned. Requires little digestion. Food examples are soups, cream cheese, white meat chicken or turkey. Fruit juices, cooked fruit, tea, coffee, milk, cream, butter, cooked cereals, eggs, not fried, cooked vegetables. Light. Between soft and regular. Should not be fried. Avoid rich, spicy, and coarse foods. Foods allowed if baked, broiled, or boiled. Avoid rich pastries, fried foods, coarse cereals, no bran, and pork. Content 6. The purpose of therapeutic diets. Therapeutic diets are diets which are adjusted to meet special dietary requirements. Low sodium restrictions. Low sodium restrictions: mild, moderate, or severely restricted. Foods high in sodium include meat, fish, poultry, eggs, milk, and milk products. High sodium foods: pork, potato chips, soda, pickles, processed meats, and canned foods. Low sodium foods: fruits and fresh vegetables. Calorie restricted: prescribed for the overweight patient or certain disease processes. High calorie: for patients who are underweight or malnourished. Low fat, low cholesterol: for patients with vascular, heart, liver, or gallbladder disease. Examples of allowed foods: low fat cottage cheese and skim milk. Low residue: low in bulk for patients with lower digestive tract disorders. Diabetic diet: for patients with diabetes mellitus. Controlled caloric intake. Diet is balanced by insulin, exercise, and/or hypoglycemic medications. Pureed: for patients who have difficulty chewing or with dental problems. The purpose of major vitamins and food sources for each. The purpose of nutrients is to supply foods that generate heat and energy, that build and repair the body tissue, and regulate body functions. Vitamins: water-soluble. Vitamin C, essential to the formation of intracellular cement substances in a variety of tissues, including skin, dentine, cartilage, and bones. Food sources: fresh fruits and vegetables. Content 7. The purpose of major vitamins and food sources for each. Vitamin A maintains integrity of epithelial tissues, helps maintain resistance to infections. Necessary in preventing night blindness. Food sources: liver, animal fats, butter, etc. Vitamin D regulates absorption of calcium and phosphorus from the intestinal tract. Food sources: butter, egg yolks, fish, liver, oils, oysters, yeasts, etc., formed in the skin by exposure to sunlight. Vitamin E, prevention of muscular dystrophy, normal reproduction. Food sources: lettuce, green leafy vegetables, rice, nuts, whole grains, etc. Vitamin K enhances the body's clotting ability and decreases the chance of bleeding by facilitating the production of prothrombin. Vitamin B6, essential for metabolism of tryptophan, needed for utilization of certain other amino acids. Food sources: meat, cereal, grains, and wheat germ. Vitamin B12 produces remission in pernicious anemia, essential for normal development of red blood cells. Food sources: liver, kidney, and dairy products. Content 8. Process for calculating fluid and dietary intake. Changing drinking water properly. Measuring intake. Calculating diet consumption and calorie count. Record percentage of each food item consumed by patient on the menu slip at each mealtime. Place individual menu slip in appropriate place per hospital policy to be picked up by the dietitian. Sample calorie count. Module 6. Anatomy of My Pyramid. One size doesn't fit all. USDA's new My Pyramid symbolizes a personalized approach to healthy eating and physical activity. The symbol has been designed to be simple. It has been developed to remind consumers to make healthy food choices and to be active every day. The different parts of the symbol are described below. Activity. Activity is represented by steps and the person climbing them, as a reminder of the importance of daily physical activity. Moderation. Moderation is represented by the narrowing of each food group, from the bottom to top. The wider base stands for foods with little or no solid fats or added sugars. These should be selected more often. The narrow top area stands for foods containing more added sugars and solid fats. The more active you are, the more of these foods you can fit into your diet. Personalization is shown by the person on the steps, the slogan, and the URL. Find the kinds and amounts of food to eat each day at mypyramid.gov. Proportionality is shown by the different widths of the food group bands. The widths suggest how much food a person should choose from each group. The widths are just a general guide, not exact proportions. Check the website for how much is right for you. Variety is symbolized by the 6 color bands representing the 5 food groups of the pyramid and oils. This illustrates that foods from all groups are needed each day for good health. Gradual improvement is encouraged by the slogan. It suggests that individuals can benefit from taking small steps to improve their diet and lifestyle each day. USDA Food Pyramid Categories. Grains. Make half of your grains whole. Eat at least 3 ounces of whole grain cereals, breads, crackers, rice, or pasta every day. 1 ounce is about 1 slice of bread, about 1 cup of breakfast cereal, or 1/2 cup of cooked rice, cereal, or pasta. Eat 6 ounces every day. Vegetables. Vary your vegetables. Eat more dark green vegetables like broccoli, spinach, and other dark leafy greens. Eat more orange vegetables like carrots and sweet potatoes. Eat more dry beans and peas like pinto beans, kidney beans, and lentils. Eat 2.5 cups every day. Fruits. Focus on fruits. Eat a variety of fruit. Choose fresh, frozen, canned, or dried fruit. Go easy on fruit juices. Eat 2 cups every day. Milk. Get your calcium-rich foods. Go low-fat or fat-free when you choose milk, yogurt, and other milk products. If you don't or can't consume milk, choose lactose-free products or other calcium sources such as fortified foods and beverages. Get 3 cups every day. For kids aged 2 to 8, it's 2 cups. Meat and beans. Go lean with protein. Choose low-fat or lean meats and poultry. Bake it, broil it, or grill it. Vary your protein routine. Choose more fish, beans, peas, nuts, and seeds. Eat 5.5 ounces every day. Find your balance between food and physical activity. Be sure to stay within your daily caloric needs. Be physically active for at least 30 minutes most days of the week. About 60 minutes a day of physical activity may be needed to prevent weight gain. For sustaining weight loss, at least 60 to 90 minutes a day of physical activity may be required. Children and teenagers should be physically active for 60 minutes every day or most days. Know the limits on fats, sugars, and salt. Make most of your fat sources from fish, nuts, and vegetable oils. Limit solid fats like butter, stick margarine, shortening, and lard, as well as foods that contain these. Check the nutrition facts label to keep saturated fats, trans fats, and sodium low. Choose food and beverages low in added sugars. Added sugars contribute to calories with few, if any, nutrients. Content 7. Types of diet. Bland. Foods that are mild in flavor and easy to digest. Spicy foods and fried foods are omitted. The purpose is to avoid irritation of the digestive tract, as with ulcer and colitis patients. Diabetic. Precise balance of carbohydrates, protein, and fats, devised according to the needs of the individual patient. For diabetic patients, match food intake with insulin and nutritional requirements. High calorie. Foods high in protein, minerals, and vitamins. For patients who are underweight or malnourished. High protein. Meals supplemented with high-protein foods such as meat, fish, cheese, milk, and eggs. Assists in the growth and repair of tissues wasted by disease. Light or soft. Foods that are soft in consistency, no rich or strongly flavored foods that could cause distress. Final stage for postoperative patient before resuming a regular diet. Liquid. Clear liquid. Broth, tea, ginger ale, jello without pieces of fruit. Full liquid. All liquids, custard, junket, ice cream, sherbet, soft cooked eggs. Usually for patients who have had surgical operations. Low calorie. Low in cream, butter, cereals, dessert, and fats. For patients who need to lose weight. Low cholesterol. Low in eggs, whole milk, and meats. Helps regulate the amount of cholesterol in the blood. Low fat. Limited amounts of butter, cream, fat, and eggs. For patients who have had difficulty digesting fats, as in gallbladder, cardiovascular, and liver disturbances. Low residue. Foods low in bulk. Omit foods that are difficult to digest. Spares the lower digestive tract, as with patients having rectal diseases. Normal or regular. Provides all essentials of good nourishment in normal forms. For patients who do not need special diets. Pureed. All foods have a mashed or smooth consistency, no chunks. For patients who have difficulty chewing or have few or no teeth. Soft, mechanical. The foods are the same as on the normal diet, but they are chopped up or strained. For patients who have difficulty in chewing or swallowing. Tube feeding. Milk formula or liquid forms of meat, vegetables, etc., given to patients through a tube. For patients who, because of a condition such as oral surgery, can't eat normally. Calorie count. Equipment. Calorie count sheet. Module 6. Criteria. Accurately tallies a calorie count. Identify patient and verify that a calorie count is needed. Encourage patient to eat all of food on tray, or as much as they are able to eat. Assist as needed. Remove tray and estimate amount of each item eaten. Mark the percent of each item eaten on the patient's menu. Place menu in collecting envelope in patient's room or at nurse's station depending on facility policy. Some facilities have actual calories listed by each item on the menu to assist in calculating caloric intake. Total calories at the end of the shift if required by your facility. Some facilities may have the dietitian come to the patient's room to collect menus that have been marked with percentage eaten. Informed licensed nurse if the patient eats less than 50% of a meal. Breakfast example menu. Dinner example menu. Thank you for your attention.